نبدي محاضرة اليوم عن infectious disease, and I talk today about pertussis and varicella infection. Start with the pertussis or whooping cough اللي هو السعال الديكي. طبعا الاسم القديم سابقا هو whooping cough. It is caused by bacteria which is called Bordetella pertussis, bacteria which is Fastidious gram-negative Coccobacilli. Another type, which is Bordetella parapertussis, it is an occasional cause for sporadic pertussis. بس طلاب، منو ممثل المرحلة؟
دكتور الممثل حاليا ما موجود. أنا أنوبانا.
منو أنت حضرتك؟
مصطفى عقيل.
مصطفى، ايش قد عدد المرحلة؟
180 دكتورة.
180. الحضور فقط 40 طالب؟ يعني نهائيا ما مقبولة حضوركم. وهو المحاضرة كان 50 طالب فقط. بالنسبة للحضور عليه درجات، يعني لا تصورون مجرد غياب وخلاص، عليه تقييم وعليه درجات، وممكن بأي محاضرة أسوي كويز وأيضا الكويزات عليها درجات. أوكي. Pertussis, it is extremely contagious with attack rate of about 100% in close contact, and after intense exposure, the rate of clinical infection about 80% in fully immunized or previously infected individual. يعني حتى لو كان الشخص ماخذ اللقاح أو إنه هو previously صاير عنده pertussis infection، إذا كان أكو أحد وياه بالبيت مثلا أو intense exposure at any place، ممكن يصير عنده subclinical infection in about 80–100%. So neither natural disease or vaccination produce or provide complete or lifelong immunity against reinfection or disease. Also, mother will provide little protection to young infant لأن الأماية أيضا الأنتيبودي الموجودة عندها سواء previous infection or from vaccine, it will decrease after many years. So it will give only little protection for young infant، ولذلك حتى النيونيت نشوفه معرض أنه يصير عنده pertussis infection. The transmission of pertussis, it is mainly by droplet, which is released during intense coughing, especially in catarrhal stage. So when there is a sneezing or coughing, this is a droplet which is contain the bacteria, and this can survive on the surface for days. يعني ممكن هاي الدروبلت تبقى على اللابتوب، على الدور نوب اللي هي يدة الباب، any surface ممكن تبقى for days. Or if there is another person will come in direct contact and hold the eye or the nose, it will get infection. So transmitted by these droplets. Clinical manifestation of pertussis, incubation period about 3 to 12 days and into 3 stages. The first stage, which is the catarrhal stage, about 1 to 2 weeks. It is begun with congestion, rhinorrhea with low-grade fever, sneezing, lacrimation, conjunctivitis, and mild dry cough. المين symptom والمين complaint بالبرتوسيس هو الكافينج. أول ما يبدي يكون mild dry cough. In the second stage, which is paroxysmal stage, which about 2 to 6 weeks, here the cough will begin as dry, intermittent, and then progress into paroxysm. Paroxysm يعني نوبة. So during the attack of paroxysm, the chin and face will held forward and the tongue protruded maximally. As we say in this child, he opened the mouth, the tongue protruded outside, the face will become purple, congested, and until cough ceases, there will be a loud whoop, which is forceful inspiratory gasp. يعني after paroxysm of cough, the child will take deep inspiration, forceful inspiration, and this is will lead to whoop. الووب هو الصوت اللي يصير بالووبين كف، وعلى أساسه سموه السعال الديكي، مثل صوت الديك. This whoop is not apparent in infant less than 3 months of age and adult. يعني بالنيونيت السمول infant، بالادلت يكون not so apparent. As we hear now, إذا سمعتوا الصوت بالبداية يكون coughing, at the end of paroxysmal coughing there is the whoop. هذا الصوت بالأخير هو هذا إحنا نسميه الووب. حتى نعيد الفيديو.
دكتورة بس ماكو صوت.
ما جاي تسمعون الصوت؟
لا دكتورة ماكو.
خلينا نشوف حتى لو على المحاضرة الجاية شوف شنو المشكلة وأنزل لكم الفيديو. أوكي. In the infant less than 3 months of age, بالunit not showing the classic stages اللي حكيناها تكون shorter duration. الcatarrhal stage only for a few days, and after that the young infant or neonate will become choked, gasping, and redness of the face. الcough may be not prominent and whoop infrequently occur. يعني مو شرط تلقى بالunit typical whoop. Cyanosis can follow, and coughing, paroxysm or apnea can occur without cough. So the apnea, it may be the only symptom in the neonate. يعني ممكن يجي neonate with pertussis, only symptom هي الapnea. There is no coughing and no other symptoms. Immunized child has foreshortening of all stages of pertussis. يعني فائدة اللقاح هنا احنا قلنا انه ما راح يعطي complete protection أو total protection from pertussis. So it benefit shortening the stages of pertussis. إذا ما أخذ اللقاح كل هاي الاستيجات اللي حكيناها راح تكون shorter duration، بالإضافة إلى الcomplication اللي راح نحكيها للpertussis راح تكون less or mild. The third stage of pertussis هي الconvalescent stage أو نسميها فترة النقاهة. هذه ممكن تكون 2 weeks and more, and her severity, number, duration of paroxysmal cough will diminish, and there is a chronic cough may persist for several months. Finding on physical examination is informative. يعني من تيجي تفحص تسوي respiratory examination أو general examination for infant أو child with pertussis, there is no specific finding. There is no dyspnea, there is no crackles in the chest, only in case of secondary bacterial infection. إذا صاير عنده secondary bacterial infection ممكن تلقى finding بالrespiratory. Otherwise, pertussis not cause any specific physical finding on examination. We only can find there is conjunctival hemorrhage and petechiae on the upper body. هذه ممكن تصير بسبب لو during paroxysmal coughing there is increase intra-abdominal intrathoracic pressure فممكن يصير عندنا hemorrhage and petechiae. Otherwise, there is no specific finding. For diagnosis of pertussis, we have typical clinical representation, as we say, and by complete blood count, there is a leukocytosis, increased white BC count in about 15 to 100 cells per cubic millimeter with absolute lymphocytosis. This is characteristic in the pertussis. Chest X-ray, in case of pertussis, without complication, there is no specific finding. But if there is complication, so we can find there is perihilar infiltrate, oedema, telectasis, pneumothorax, or mediastinum, only when there is complication. We can isolate the bordetella pertussis in culture of specimen obtained by deep nasopharyngeal aspiration. We can do PCR, and we can also do serological tests to detect the antibody for pertussis bacteria, which is IgG or IgM antibodies. We have some complication for pertussis infection. This include first apnea, as we say, it is especially in infant less than 3 months of age. Secondary bacterial infection, such as otitis media or pneumonia, bronchiectasis, conjunctival and scleral hemorrhage, epistaxis, hemorrhage in the CNS and retina, and this is result due to an increase intrathoracic and intra-abdominal pressure during coughing. Pneumothorax and subcutaneous emphysema also occur due to increased intrathoracic pressure during coughing. umbilical and inguinal hernia due to increased intra-abdominal pressure during paroxysm. Seizure, it can be occur in the pertussis. The main cause for seizure in the pertussis occur due to hypoxemia. من يصير الطفل عند paroxysmal coughing, there will be apnea, there will be brain anoxia. فمن يصير عند البرين anoxia هذا يعتبر أهم cause for seizure in pertussis. البرين anoxia أو الهايبوكسيميا. Other cause اللي هي less common ممكن intracranial hemorrhage or hyponatremia occur due to excessive secretion of antidiuretic hormone. For treatment of patient, we have indication for hospitalization. يعني إحنا ممكن طفل عنده pertussis أحتاج أدخله للمستشفى. We have some indication for hospitalization. First, if infant less than 3 months of age, you should admit to hospital without any exception. إذا كان neonate عمره in small infant أقل من 3 أشهر هذا لازم تدخله. Second one, those between 3 to 6 months if paroxysmal as severe. And those of any age if there is significant complication. الcomplication اللي ذكرناها إذا كان عندنا طفل أي significant complication you should be admitted. This only the indication for hospitalization. Otherwise, not need to admission. We can't treat him at home. Treatment first, there is supportive care for the child, and first we should be avoid any provoking factor for cough. احنا عندنا المشكلة الأساسية هي الباراكسيزمال cough، فأي شيء ممكن إنه يعتبر provoking factor للcough you should be avoided like smoking, excessive stimulation, dust, good hydration with adequate nutrition, avoid large volume feeding. إذا الطفل كان يرضع نحاول ننطيه small frequent feeding ونقلل الرضاعة أفضل من أنه تنطيه large volume feeding. If there is excessive secretion, here we should be do frequent suction to clean the airway or prevent aspiration. The second line of treatment, we should give antibacterial infection, and drug of choice we give azithromycin. This is drug of choice in the neonate. احنا نقدر نعطيه at any age طبعا. الدوز 10 mg per kg per day for 5 days. Other drug alternative هو erythromycin, also it is macrolide from the same group, 40 to 50 mg per kg per day and 4 doses for 14 days. erythromycin ما نقدر نستخدمه بالنيونيت because it's associated with hypertrophic pyloric stenosis. So in the neonate you should give azithromycin. In other age, بالolder child, بالinfant ممكن تستخدم azithromycin or erythromycin. Anyhow. Other drug we can use clarithromycin, trimethoprim, sulfamethoxazole. We should isolate the patient immediately after diagnosis and until 5 days after initiation of the therapy. And this macrolide agent should be given to all close and household contact regardless age, history or immunization symptoms. يعني كل اللي موجودون بالبيت موجودين ويا الطفل ومختلف الأعمار سواء adult, elderly أو child، سواء ماخذ لقاح أو ما ماخذ لقاح لازم تنطي الماكروليد، يعني تنطي erythromycin or azithromycin for all close and household contact. A prevention of this disease mainly by vaccine which is given together with the diphtheria and tetanus vaccine. ما راح ندخل بتفاصيل الفاكسين لأن أنتم ماخذين. The other disease we talk about is varicella or what is called chickenpox. Chickenpox هو الجدر المائي. It is caused by virus called varicella zoster virus, which is double-stranded DNA herpes virus. It causes primary infection, which is called varicella or chickenpox. This infection results in lifelong latent infection of sensory ganglion neuron. يعني من يصير عند الشخص البرايمري infection اللي هي chickenpox يبقى الفيروس latent in the sensory ganglion. Later on ممكن يصير reactivation. When there is reactivation of the latent infection, it will cause herpes zoster أو shingles. اللي نسميه بالعربي الحزام الناري. هذا يكون later on. It is rare in children. It is mainly occur after 40 years of life. The patient with varicella are contagious from 24 to 48 hours before rash appear and until vesicle are crusted. Usually 3 to 7 days after onset of rash. هي الفترة اللي should be isolate the patient because can cause infection to another. Transmission either by respiratory secretion or direct contact with the skin lesion. احنا عندنا chicken pox, it will cause vesicular skin lesion. راح نتكلم عنها. ممكن ينتقل من شخص لشخص يا اما عن طريق الريسبيراتوري دروبلت او عن طريق الدايركت كونتاكت with this vesicular lesion in the skin. After an incubation period, which about 10 to 21 days, there will be fever, malaise, anorexia, and headache with mild abdominal pain. This is lasting for 24 to 48 hours. After that, the rash will appear. يعني يبدي specific manifestation. After 48 hours, يبدي يظهر الراش, and the fever will persist during the first 2 to 4 days after onset of rash. يعني حتى ورا ما يطلع الراش تبقى الفيفر continue. The rash of varicella, it is appear first on the scalp, face, trunk, and initially consists of intensely pruritic erythematous macule. pruritic يعني يسوي لنا itching أو حكة عند الطفل. Evolve through babule stage to clear fluid filled vesicle. يعني يبدي macule بعدين تتحول إلى babule وبعدين تتحول إلى vesicles contain clear fluid. After that will be clouding of this fluid occur in about 24 to 48 hours. The distribution of this rash is centripetal. Centripetal نقصد به إنه هو mainly in the central part of the body, يعني in the trunk, in the face, and it's less common in the extremities. This is the rash of the varicella, and as we see here, there is multiple stages of the rash. يعني كل الستيجات نشوفها. هنا ممكن اكو ماكيول موجوده، هنا بابيول، وهذه لاست ستيج اللي هي الفيزيكلز. هذه الفيزيكلز تحتوي على كلير فلويد وبعدين راح يصير بيها كراستيشن. هذه الفيزيكلز is so clear. So in the نفس البيشنت راح تلقى different stages of the rash. اخر شيء راح يصير بيها كراستيشن الفيزيكلز. هذه هنا عندنا الفيزيكلز will be crusted. And also here, this is the crustation of the vesicles. This is the last stage of the rash. A neonatal chickenpox, if a pregnant woman get varicella infection, يعني later in a pregnancy, 5 days before to 2 days after delivery, the infant will become at high risk for varicella infection. يعني إذا كانت الأم صار عندها varicella infection، خلينا نقول 5 days قبل الولادة أو 2 days after delivery. هنا النيونيت يكون liable for infection. ليش؟ لأن contact with the mother ما نقصد به إنه الانفكشن راح تنتقل عن طريق البلاسنتا، لا، عن طريق الدايركت كونتاكت، لأن after delivery طبعا الأم ما راح تلزم الطفل تعتني به ترضعه، فيصير contact between mother and neonate. فهنا النيونيت راح يكون liable to get infection from his mother. إذا الانفكشن occur in the mother 5 days or 2 days after delivery, there is no time to develop antibody in the mother and transmit to the neonate to get him protection. So this neonate liable for severe infection. بهالحالة النيونات after delivery immediately you should give him human varicella zoster immunoglobulin, and if develop chickenpox we give him a cyclovir. But if the mother developed varicella infection more than 5 days prior to delivery, يعني قبل الولادة خلينا نقول أسبوعين, now there is time to develop antibody. This antibody transmitted through the placenta and give protection to the baby. فالنيونات هنا حتى لو ياخذ الانفكشن من الأماية هو عنده antibody already ماخذها من الأم، فيكون mild infection not severe. We have what is called congenital varicella syndrome. هنا congenital varicella syndrome if infection occur in early pregnancy. بالfirst pregnancy, 20 weeks of pregnancy, so 2% of fetus will demonstrate congenital varicella syndrome due to transmitted through the placenta. And when we examine neonates with congenital varicella syndrome, the important sign we find what is called Thi-Qar, اللي هو zigzag scarring. This is occur in a dermatomal distribution with hypopigmentation due to damage to sensory nerve. There is microphthalmia, cataract, chorioretinitis, and optic atrophy. Also, there is microcephaly, hydrocephaly, maybe, and brain calcification. Hypoplasia of extremities with motor and sensory deficits, anal and urinary sphincter dysfunction. As we say in this picture, this is a neonate with congenital varicella syndrome. The most important feature هذه البلاك area هي السايكاتريكس اللي قلنا zigzag scarring واللي يصير على الديرماتوم with hypoplasia of extremities. هنا الإذكار more clear. This is the cicatrix occur on the lips, and also here this is scarring, which is called cicatrix. This patient also there is cicatrix in the lower limb on the leg and hypoplasia of the lower limb. This is characteristic for congenital varicella. For diagnosis of congenital varicella syndrome, the mother gives history of chickenpox infection during early weeks of pregnancy, and also there is stigmata in the fetus. PCR we can do to detect viral DNA in tissue sample. Varicella zoster virus immunoglobulin IgM antibody we can detect it in the cord blood sample. And there is no specific treatment for congenital varicella syndrome. It is not progressive. مو مثل اللي احنا ذكرنا بالcongenital rubella syndrome. ممكن تطلع عندنا new manifestation later on. It is progressive. The congenital varicella syndrome is not progressive. Only this feature which is occur in the neonate, and we have no any specific treatment for them. For diagnosis of chickenpox in children, we depend first clinically on the rash, nature of the rash. There is leukopenia in the white BC, incomplete blood count with relative lymphocytosis. Direct fluorescent assay to detect or identify virus from cutaneous vesicular lesion. Also, we can do PCR or detection of IgG and IgM antibodies. We have some complications for chickenpox infection, especially occur in children with low immunity. If the patient have immune compromised disease, مثلا عنده leukemia أو ياخذ chemotherapy or take prednisolone for a long time, this affects immunity. So those child when chickenpox, they liable for severe and serious complication of chickenpox. The first complication when there is secondary bacterial infection of a skin lesion. لأنه هذه السكين lesion الفيزيكلز بيها fluid ممكن يصير بيها secondary bacterial infection, and this is can cause superficial impetigo, cellulitis, and subcutaneous abscess. طبعا هنا الموست common bacteria هي الستاف وممكن أيضا streptococci. CNS complication like encephalitis and cerebellar ataxia. The other complication which is called Ray's syndrome. Ray's syndrome هي hepatic encephalopathy. This is occur in case of varicella with aspirinosis. يعني إذا كان الطفل عنده varicella احنا قلنا راح يصير عنده fever. إذا نطيته الأسبرين كتريتمنت للفيبر as antibiotic وهو الطفل عنده varicella, it will lead to complication what is called Ray's syndrome, which is type of hepatic encephalopathy. So aspirin, as we said, is contraindicated to use in children as antibiotic. Other CNS complications like transverse myelitis, Guillain-Barré syndrome, and pneumonia. Other rare complications like hepatitis, nephrotic syndrome, hemolytic uremic syndrome, pancreatitis, thrombocytopenia, this is rare complication. How treat a case of chickenpox? First, you should know that aspirin should not be used as antibiotic in varicella. We can give calamine lotion for soothing pruritus or use antihistamine. احنا قلنا الراش اللي راح يكون pruritus intensely pruritic cause itching. فحتى نقلل البروريتس we can use calamine lotion أو نستخدم antihistamine. Acyclovir, it is only indicated in severe disease. يعني مو كل كيس chicken pox احنا نعطي الأسايكلوفير اللي هو antiviral drug. It is given only in severe cases and in immune compromised patients. Dose we can give IV 10 milligram per kg per dose every 8 hours. And we can use oral acyclovir for children with herpes zoster. الهربس زوستر احنا ما تكلمنا عنه لانه it is very rare in children. It is mainly occur 40 years of age, يعني after 40. هو نوع من الفيزيكلز اللي راح يعني تظهر عند الطفل on the sensory dermatome، يسموه الحزام الناري. Prevention of varicella infection. First, we should give varicella vaccine. We have varicella zoster immunoglobulin, and this is given for post-exposure prophylaxis. This immunoglobulin should be given within 96 hours of exposure. This is indicated for who? It is given for immune-compromised patients, for pregnant women, for newborn whose mother developed varicella 5 days before to 2 days after delivery, as we say, for a premature infant less than 28 weeks of gestation, and for high risk in close contact with patient have herpes zoster. يعني أي واحد من دول اللي ذكرناهم إذا صار in close contact مثلا بالعائلة موجود شخص وياه عنده chickenpox، دول كلهم low immunity, have risk factor, liable for progressive varicella, so should give varicella zoster immunoglobulin ولازم ننطي 96 hours after exposure. Thank you for listening. Any question, طلاب؟